Hello everyone, hope you all are doing great. And yes, I do apologize for not being updated with the channel for so long. But here I am again with my new YouTube video, which is about history taking and dental examination. Oops, I haven't written it there, but okay. I have taken this topic from Oxford Handbook of Clinical Dentistry, which is also known as Pink Book. Okay, before starting, I just want to apologize for this bit shaking in the video because I'm not making the video directly from the laptop because my laptop is not working properly. So I'm directly covering the topic from my PowerPoint presentation slides. So I hope you don't mind this shaking. Okay, coming back to the topic again. There are a few things which we have to remember while taking the history of patient and examining the patient. So I'll be discussing these points step by step and then precise. So first point is look, listen and learn. Now what I actually mean by looking is that you have to observe the patients while they enter the surgery and sit in the dental chair because watching them can provide you with several clues which are important for making provisional diagnosis. For example, watching body language, gait, appearance, age, tone of voice, degree of eye contact they try to make with you. So these are the things which you have to take into consideration while patient is coming to you. Okay. Coming to the next point, it's about listening, or if I say in proper words, it's about active listening. Now, what is active listening? Uh, we can say that active listening is a process that includes both hearing what is being said as well as processing and interpreting the words that are spoken to understand the complete message that is being delivered. So, what you have to do is you have to listen carefully to your patient, what he or she is trying to convey to you. And other thing you have to do is you have to extract information from those words that are being told to you by your patient, so that it becomes easy for both a patient and the dentist. So, for that, you have to allow your patient to speak uninterruptedly. Because if you allow your patient to speak without any interruption, uh, this will give you the information that is necessary to make provisional diagnosis and other useful personal information. So, always remember to be patient with your patient and allow them to talk freely. Okay, moving to the next point, it's about learning. So what you have to learn is that learn to use plain speech always, or in layman language I say use simple words that are easy to understand for the patient. Okay, because most of the times patient don't understand medical or dental terms as they are untrained, they are not trained medically or dentally. So always try to learn to use plain speech. Okay, now last point which I want to discuss with you people is about question asking, because question asking is a key part of history taking. Now you have to learn what kind of questions you can ask and what are the questions you have to avoid. So, the questions which you have to ask to the patients include open ended and close ended questions, and the questions that are strictly avoided are leading questions. Okay, so getting into a little detail about question asking. First, we will learn about open ended and close ended questions. So, open ended questions in simple language, we say, are the questions that require a patient to answer with more than a simple yes or no, or just simply nod the head. Whereas close ended questions generally limit the patient's response to either a yes or no. Okay, so for example, if you take an example, if I ask my patient, how are you feeling today? So you see, that's a kind of open ended question because it allows the patient to answer in free form and possibly give me more detail about the condition of his or her health, right? On the other hand, if I ask my patient, are you feeling well today? So that's a kind of close ended question because it leads the patient to answer with either a yes or no. All right. So we have to take care about this also because in generally open ended questioning is a preferred technique to use because it compels the patient to provide more detailed information. All right. So yes, talking about the leading questions, in simple words, leading question is a question that assumes the answer. All right. For example, if you ask your patient, you didn't complete the course of antibiotics I prescribed, did you? So it's a leading question as it assumes that the patient did not finish the antibiotics and leads them to give specific answer. However, if you ask, did you finish the course of antibiotics I prescribed? So you see, uh, it doesn't ensure to know whether the patient did or did not finish the antibiotics and is more likely to get an accurate response. So let's take in another example. For example, instead of saying you must be in too much pain, you have to ask, you just ask, can you describe your pain or are you in pain? You don't have to ask like, are you must be in so much pain. That's a leading question, okay? So you have to avoid such kind of questions. Okay, I think this will be all for this video, and in my next video I will be covering the entire dental history and medical history, how it is taken and what's the procedure for that. So for that, please do like and subscribe my channel and keep yourselves updated with my YouTube videos. Thank you so much for watching. Bye bye. Take care.